Mr. Frank Chen said earlier on the radio. He said we could. He only mentioned the capacity we have, but we're not able to set a target. We can't set a target because it's really up to the public to decide whether to take the test. And of course, this is not an easy task. Nothing is normal now, and if we do anything, someone will always come up with a conspiracy theory. They try to tell people not to do this and that and so on. So, but what we are saying today is so that we could come off this epidemic as soon as possible, so that we could resume our economic activities as soon as possible. I'm appealing to the media to give an objective report, and appeal to the public to take part in this universal community testing scheme, which doesn't take up much of your time. Now, there's another issue raised by political parties. That is, we need to have a Hong Kong health code before people could enter certain premises. That way we could resume our economic activities. Well, that's why just now we gave you a presentation on the health code, but that may cause confusion, actually. It seems that people are confusing different messages. Now, the health code is meant for traveling. Only because you want to travel, you will spend money to do a test and get a negative test result. And then you're able to meet the public health requirements of the place you want to go. Or in future, if we have travel bubble arrangements with other places, there will be a requirement to show a negative test result, and that's the purpose of the health code. Now, if this arrangement will also apply to cases where people enter certain public premises or government offices and so on, it may not be practical, and it is not fair. If, say, I just want to go into a government building or a restaurant, I have to first take a nucleic acid test before I can go into these premises. Well, it's not fair. That's why I've never considered this proposal. And even in other countries, people are not required to take a nucleic acid test before they can go into certain premises, because there's a totally different system. We don't have the system to do so. And perhaps Mr. Sid could explain to you what the system is on the mainland. Why is it that they are able to put in place such a health code system, but in Hong Kong, it's not that technically we can't do it, but perhaps it won't be accepted by the public.
In order to implement the mainland healthcare system, a real name registration for mobile phones is needed, or mobile phone numbers, and the whereabouts of citizens must be consolidated and traced in order to ascertain whether someone might have visited a place involving infections. Under the current climate in Hong Kong, like the Chief Executive said, for the public to accept such a proposition is not realistic. That's why we have no plans to implement health code tracing in Hong Kong. Next question.
Follow-up questions. Have your scientific advisors given you sort of what number would be a good minimum for this community-wide testing scheme to make it worthwhile? And if so few people may volunteer, do you think that the government would consider offering sort of like an incentive, maybe a cash incentive for people to take part? And on that point about the health code, can you just definitively say, is that something that the government will be completely ruling out, that idea of a local health code system? And Sophia Chen, just one question on the vaccine. Can you just tell us a bit more about what the government is doing in terms of trying to acquire those vaccines, and how many in total you would really want to cover Hong Kong?
Sorry, what media organization, please?
RTHK.
Thank you.
Well, as far as the universal community testing, from the experts, I mean my 4 experts on the panel, from the very beginning, testing is regarded as very important by the experts, especially by Professor Yun, because it is through testing that we could identify as early as possible the infected cases and then put them under isolation and treatment so that there will be no chance for the disease to spread. So there's no doubt about the value of testing. The second question is, depending on the capacity of every place, then you have to prioritize your testing arrangements. So all along, we have been focusing on testing what we call the higher risk groups, those who have symptoms, those who are arriving from abroad, those who go to see private doctors, and so on. And a month ago, we started to extend this testing because we have more capacity. We extend the testing to what we call the specified groups. So staff working in elderly homes, nursing homes, and staff working in restaurants, and also staff working in property management companies and transport sector, and so on. Okay. So if you ask me if capacity continues to be a constraint, then this type of universal community testing free of charge available to asymptomatic people may not be a priority. But given the severity of this current wave and the fact that we still have 30 to 40% of cases with unknown sources, which means that there is still quite a number of silent transmitters in community. So the more that we could test, and the earlier we could find the remaining outstanding cases. And since the Central People's Government has come forward to help us to provide this additional capacity through the additional laboratories that you have seen in one of our sports venues, through mobilizing several hundreds of technicians to help us to test in order to meet the requirements from this universal community testing, we now have the ability to proceed to doing this lesser priority testing. Let's put it that way. But this is a one-off exercise. I don't envisage that we could continue to do it, and it would not be very cost-effective to keep on doing a universal community testing of this nature. And that's why we have not set for ourselves any targets. If you ask me, our objective is to encourage as many Hong Kong people to come forward to receive this free of charge testing so that they can be assured of their own situation and they can help us and help society to recover as soon as possible. The test is free of charge. The testing arrangements will be very simple, and the testing stations will be very convenient. I think those are the incentives that we have designed in rolling out this community mass testing. But at the end of the day, it is the conscientiousness and the civic responsibility of every Hong Kong citizen that counts. So again, I repeated my appeal to the people of Hong Kong that please come forward to do this universal community testing. As far as the health code, I noticed that you use the word local health code, and maybe that's a good way to describe it. Health code by itself is not very meaningful. It's what is the purpose of the health code. The health code contains some very basic information about this individual, and more importantly, about the health status of this individual. So in the case of COVID-19, the most relevant health status of this individual is whether he or she has received a test and the result is negative, and hence he or she can travel within a limited period. Okay. So the health code that we have been working on so far and had discussions with Guangdong and with Macau is for traveling. Similarly, that same health code will be used for traveling to overseas countries once we have the travel bubble in place with other countries. It is not a sort of health code for local access for access to local institutions or catering or things like that. It's just not practicable to have a health code in Hong Kong for that purpose. Dr. Chen?
Regarding vaccine procurement, currently there are a number of candidates having vaccine research, such as clinical trials for safety and also efficacy evaluation. And we know that there will be very keen global competition. And also, Hong Kong needs to take early actions to reserve or procure potential vaccines for our population in a timely manner. And in this regard, we will pursue a two-pronged strategy for procurement of vaccines. On the one hand, we plan to make a binding commitment to participate in a COVAX facility co-led by Gavi and also the Vaccine Alliance, the Coalition of Epidemic Preparedness Innovations, and also the World Health Organization, which would be a safety net to secure vaccines for about 20% of the Hong Kong population. But at the same time, we will also pursue additional supplies through the advanced purchase agreements with individual vaccine developers, having regard to the scientific evidence and also clinical data available in consultation with the scientific committees under the Department of Health. So we will be closely monitoring the situation. And the Chief Executive have also written to the Central People's Government to register our request for support when mainland vaccines are available.
最後兩位今日右手邊。
Last two questions. The lady over there, please. I'm from Commercial Radio. About relaxing the social distancing measures. Would that tie in with the universal community testing scheme results? You said actually you have not set a target for that scheme, but what if there is a low participation rate, and on what basis would you relax the social distancing measures? Now, the hospital authority said that there is actually a rather low percentage of specimen bottles collected from general outpatient clinic, even for higher risk groups such as restaurant workers and container terminal workers. The return rate of specimen bottles is not high. So what can you do to and give incentives to to people with not without high risk to take part in the testing scheme? Otherwise, how are you going to make sure there is a good participation rate? On the first question, I must make myself very clear. I read on the newspaper that they learned from a source that we would have to wait till the universal community testing scheme is completed before we would consider relaxing the social distancing measures. That is not our position. That's never been our position. Actually, if you've been following what I said, I appeal to the public to be patient for a little longer, because in the coming weeks, certain things will become more certain. First of all, whether the downward trend of infection cases is going to persist. And we're not talking about 1 or 2 days. We're talking about 7-day moving average when we see a downward trend. So we want to see in the next few days whether that's definitely the case. And the second thing is that for the high-risk groups, we'll wait a few more days to look at the test results and the follow-up work. Now, and then for the universal community testing scheme, we are now in a position to start scheme. And we never said that we'll wait till this universal testing scheme is completed before we would consider relaxing the social distancing measures. In fact, what we've been doing in the past few days is to meet with the relevant sectors. Last night we met with the beauty care sector, and we have also met with the catering sector, and then the secretary, and then there will be discussion with the sports sector to see how we could gradually reopen the facilities. Another point. Well, yes, the public see that there are fewer cases now. Maybe they are less worried, so maybe there is less of an incentive to take the test. Is only to be expected. But here we're talking about public health crisis. So please set aside your own considerations for the good of the community, for Hong Kong to come out of this epidemic sooner. Please, chip in by taking the test. It doesn't matter whether you are in the targeted groups or you are without symptoms. Please take advantage of this opportunity to take the test, because then we will have a better basis for us to take measures that the public would like to see. For example, relaxing social distance measures so people could resume normal life. For example, when they work out, they don't need to wear a mask, or they could cross the boundary to visit friends and families. And this is something the public would like to do. But if we want to do that, we must all play a part. Now, apart from wearing the masks and observing personal hygiene, we are also asking the public to take this test. Last question, please. On the left, at the back, there, the lady. Good afternoon, I'm from Ming Pao. I have a number of questions. If